Okay, I think we're ready. So welcome everyone. Today we are going to be talking about the McKenzie Method, which if you have been in the clinic at all recently in the last couple of years, is something that I know I've put you through in almost every one of our cases because it is such a powerful tool for not only determining the nature of an injury, but helping us to understand our recommendations and care plans and outcomes with an injury. Now, specifically where this technique has gained such notoriety and such use over time is with disc injuries and nerve pain. And this is something that we will talk a little bit more about, but as time has gone on, it's really been kind of upgraded, and we now understand that it can be used for a multitude of different musculoskeletal injuries. And so our goal here is that we're getting more than a diagnosis when we're treating people. And so when we see things like shoulder issues, ankle issues, people coming in looking crooked or sideways and we're in a lot of pain, we want to be able to do something and help you right away. And so when it comes down to it, what is this really all about? We want a reliable assessment. We want to be able to do something time and time again where it is the same. So when we get different information, we can then do something with it. We want to be able to decide, like, if I have you go home with your treatment, your therapy based on this method, it should tell me something as a clinician that allows me to make either a better decision or a different decision the next time you come in. It's effective in almost any and all joints and soft tissues of the body. Being able to break an injury down into an understanding of a joint, a muscle, a tendon, a ligament, whatever it is, we get good knowledge from this approach. Then we want to look at, is it effective for other things and the big deal things? So like disc injuries, herniations, bulges, stenosis, and even arthritis. This technique can be extremely powerful for understanding what movements are good for you, what movements are bad for you, and then you can be treating yourself when you're not in a clinic. And finally, we have the ability to even get body parts that are chronically injured and have been irritated for decades to respond. And that's, I think, a huge tool that a lot of people that have dealt with chronic pain kind of overlook. You get to a point where you're like, it's not going to get any better. What can I really do about it? This is something that we get an insight as a clinician of what can we do about it? What can we do better to help you feel better? It gives us a roadmap towards recovery, and we want to help you feel better every day. So where does pain come from? When we look at things, we look at like the issue of like a disc injury. When we look at discs in this little picture over here to the side, we've got our bone, our disc, and our bone. When I play the video here, it might talk on your computer. If it does, please turn your volume down because it tends to be a little bit loud, but it kind of shows what a disc herniation can look like. And I'll mute that here and see if that helps. But as we have that video load, disc tissue is very moldable. It changes. And so when we have a bulge like that, it often has a directional preference. It has a movement that's going to help make that better or worse. But we also look at joint derangement, which means the joint itself has problems. We have issues within the joint not moving the way it should, that just like a door that isn't hung right might not close. Soft tissue dysfunction, that's when the tissues around the joint are injured and not behaving the way they should. Contractile dysfunction, that's where within the muscle belly itself, the muscle doesn't want to stretch. And these tissues all have different pain responses based on tension or compression, chemical irritations, infections, behaviors in your lifestyle. But these different pain reasons, these issues come from a place of like, we want to be able to understand that. We want to be able to put good use to it so that you can get better and have improvements. Oops, jumping ahead here. So how does, there we go. That's how good I am with PowerPoint. So when we look at how we implement the McKenzie method, how does this work? The gibberish term is that we are trying to classify your injury examination based on established baselines and movements, positive orthopedic tests. We want to evaluate your injury with repeated movements and sustained postures. What does this mean? This means that we are going to help you deal with your injuries by getting specific clues based on movement. Your body's going to tell us what will help it work better or what might make it worse. That pathway will lead us towards you getting what we would call a directional preference. And that really is as literal as it says. It means there's a way that you will move that will help your injuries recover. And there are ways you will move that will make that injury worse. And the benefit of that is that you can leave at your first day knowing, here are some things this person thinks that's going to help me feel better. And I can feel different when I do them. But more importantly, I now have a list of things that I shouldn't do because likely it's going to make my pain worse. And when we think about especially chronic pain, if you've ever been sunburned, you know that that can sting. And if you go out on the beach one day and you get sunburned, and then the next day you go out and you get sunburned again, and the next day you go out and get sunburned again, it's not the first time you got sunburned. It's the fact that every single day you're not giving your body a chance to heal, and that sunburn persists. And so when we talk about chronic pain, in many situations, we have not ever taken the chance to give our body an opportunity to heal by taking out directions or movements or activities that make it worse and implementing strategies that help it move better. And that is really what our first couple of sessions around the McKenzie Method is about. We want to figure out, even when you're really hurting, what can we do to help you feel better? And so one of the things that comes to be an issue when you're in pain is like, I don't want anyone touching me. The last thing I want to do when my back is killing me is have a chiropractor push on it or touch it. And so the benefit of this method is that we can have you do the movement. You don't need to have anyone push or pull or yank on you, crack or pop you. You can have movements that will show you safely how to reduce your pain. And typically within a matter of a short amount of time, you're going to feel better. And the final really great thing about this is that you're not going to get 45 exercises on 15 pages of notes. You're going to get one or two things to do that are going to be productive and really make a difference in how you feel. And so what can this technique be helpful with? A lot of the time it gets relegated to the spine, like I've got a disc injury, but where we can really start to look at benefit over time is in other joints of the body. Knees, hips, elbows, shoulders, ankles. All of these are fair game when it comes down to evaluation because, again, we look at, is the joint moving the way it should? Are the muscles around it supporting the movement the way they should? And can they contract the way they need to? And if we can answer those questions, we can then give you tools in order to recover and start to have better insights into the nature of your own injury. And so, can I do this when I hurt? Yes, you can. It is critical that we listen to your body, and especially during times of pain and injury, having the ability to understand what your pain is doing, where it's coming from, and what it means to us as a clinician that practice in this method allows us to know where to go and what advice to give you. Evaluation, examination happen at the same time during this technique. And sometimes people will come in completely bent to the side or stuck with their head in a position, and knowing how to work them out of that without being rough or aggressive allows your body to heal faster and get better results. And so as we go through our examination, as we look at what your body's telling us, we're trying to determine that directional preference for both what's good and what's bad. And once we've learned that, then we'll talk about how that goes into your daily recovery strategy. Many people don't want to deal with injuries happening again and again and again. Who would? You want things to get better and go away and never come back. This method has got power because it will teach you about an area's injury, teach you what things will help you and what will hurt you, but then gives you a tool so that you can be your own doctor. You can treat your own back pain, you can treat your own neck pain, and have success with it. To me, the value of this method and why I've spent so much time in it is that I've seen patients that have dealt with severe injuries and chronic pains now have a system that doesn't make them rely on another practitioner. They can be up in the boundary waters and have their back start getting sore. They know what to do for exercises, and they know how to treat their own pain and reduce that flare up and enjoy their life. And they also know then at what point do I need to go in and see a clinician because I've either found that my exercises aren't currently working the way they should or have historically, or I've treated myself and I'm kicking butt and I'm feeling good. And so when we look at understanding what creates problems and prevents reoccurrence, that's a big deal for most of us. I want you as our patients to get better. I want you to have a tailored care plan when you're with us so that you know specifically what your life will bring when you do certain activities and you know how to keep yourself feeling good. When people want to know, can I use this technique? Is McKenzie Method okay for me? This is a simple yes/no answer. When it comes down to it, if your pain is reproducible, if it's changeable, if it's radiating, these are things that we can look at and usually we'll understand better with repetitive movement. But if you look at this checklist here and go through it and are answering some yeses, then we should talk because the McKenzie Method will be a tool for you that can help. If you're watching this webinar and you would like a copy of this questionnaire, just shoot us an email or direct message us on Facebook or Instagram, and we can happily get this to you. In our next Tuesday is our Lunch and Learn about auto accidents. This is one that if you have never dealt with an auto accident, that's excellent. You're a lucky individual, and I hope you never do. But for those of you who have, there's a great deal of complexity that can happen with our soft tissue and our joints when we are run into. And as we talk about auto accidents, we'll talk about how do we avoid turning it into a chronic problem and how do you get better. In our next month, we are going to be in the senior perspective for our weight loss program. We were interviewed by them. There's a great article in it about the Activate Metabolic Program, about what we do. And if you see that and want to mention it to us when you're scheduling your weight loss consult, we'll give you an additional 5% off the program, save you some money. And we appreciate you looking at our shout outs that we get in the media. It's super fun. And then, as always, check out our Facebook, Instagram, and YouTube pages for not only webinars like this, where they're being posted and replayed, but also the fun stuff that Kaylin posts and all the stuff she gets us into as far as education and keeping you engaged. So we are happy to answer any questions if there are any, but we love talking about this stuff. And if you ever have any suggestions on topics in the future, we're happy to hear them. Otherwise, we hope you have a beautiful day. And we'll see you soon.